It's a very interesting question and very gratifying one to discuss, because you are discussing one of the common variety transplants what we do every day, and specifically is relevant because we are discussing post-transplant cyclophosphamide, because for some whom you don't know, this comes from our mouse work what Efri Fuchs and me did in mice more than 20 years ago. So it's now very gratifying to see that we are discussing this in a clinical setting. So things have changed in the last 6 months. There have been major paper published in New England Journal of Medicine which showed superiority of a PTCy, CNI, MMF prophylaxis in HLA match setting, and as well one antigen mismatch MUD. So seeing this question getting widely deposited comparing PTCy versus ATG is very important. I think, of course, my position was that PTCy, CNI, MMF provides advantages. There is no randomized data to justify this, but there is some very good retrospective data, and there is some feasibility data and as well some intriguing new data showing that while major transplant outcomes may be similar, there are certain advantages of PTCy, specifically that it might shorten duration of immunosuppression, and as well that it might have less infections. So I think it's something which is question which is in a part more relevant in Europe than US, because we don't use as much ATG in US. And certainly my position was that at this moment PTCy is preferential, specifically in mismatch MUD setting, but I think we still need more randomized trials to have a solidified and final answer on this question.